Have you ever got close to someone and had to step back a few feet or turn your head because they had bad breath? Better yet, have you or anyone you know had to excuse themselves shortly after eating because they had gas? Do you ever suffer with heartburn or spicy foods upset your stomach? How about lower bowel gas or bloating several hours after eating? Have you ever experienced headaches over the eyes or pain between the shoulder blades? Hi friends, this is Bud Tarreto, naturopath and nutritional consultant for Capture Your Health. In this edition of the Healthy Corner, we will be highlighting just a few of the above digestive issues millions of people suffer with each and every day. Then there is that dreaded word, acid reflux. More than likely you have heard of acid blocking drugs because you have seen them on TV commercials, short-term relief. Do they really fix the problem, and what are the long-term effects on your digestive system? More and more you hear on the news how dangerous food bacteria can be, salmonella or E. coli. What amazes me is that some people get violently sick, some feel mild effects, and others just keep on going without skipping a beat. Did you ever ask yourself, why is that? Is it that we have more salmonella or E. coli in our food sources, or could it be that more and more people are taking acid-suppressing medications? Could this possibly make them less resistant to these bacteria? When you suppress the production of hydrochloric acid in the body, wouldn't it have an effect on the rest of the digestive system? Let's look at some of the facts. Healthy HCl or hydrochloric acid levels ignites pepsin, an enzyme that plays a role in protein digestion. Proper HCl levels activate secretin that starts the pancreatic enzyme release, which in turn helps digest fruits, starches, proteins, and fats. The correct stomach pH ignites cholecystokinin, boy that's a mouthful, which begins healthy fat digestion. Oh, did I mention that one of the unforgotten roles of HCl? Kill bacteria that are on our foods. It would be very scary to see all the bacteria in our food we would never eat. Therefore, the importance of healthy HCl function, kill bacteria that causes distress. Jonathan Wright, MD, a major proponent of hydrochloric acid therapy for years, has his patients swallow a little radio transmitting device called a Heidelberg capsule to measure HCl levels. He finds a high percentage of his patients don't have enough hydrochloric acid. In his book, Why Stomach Acid is Good for You, he explains how healthy HCl levels destroy bacteria that aren't good for you. He notes about a cholera outbreak in India, how people had a healthy HCl level did not get sick. Unfortunately, most people who take the acid blocking drugs aren't aware that manufacturers originally suggested only 16 weeks of therapy. In other words, just to help with some repair work with the inflamed tissues. These medications were not meant to be lifelong therapies. However, the money in acid blocking drugs is big. In fact, Americans spend over $10 billion annually in gastric reflux. All we want is a quick fix. Take a pill and voila, no more pain. Why not? Besides the old standby antacids, we now have a whole new market of over-the-counter acid-suppressing drugs. No one wants to think about what is needed or what has to be done in order to resolve the problem. Did you know that stomach cancer is on the rise and H. pylori bacteria could be related to it? Did you ever stop and think that we could be changing the pH of the stomach with the acid blocking drugs and causing some serious side effects with the increase of the H. pylori bacteria? A study done at the University of Pennsylvania in 2006 found a 44% increase in hip fractures due to the use of proton pump inhibitors longer than 1 year. The reason for this occurrence, insufficient stomach acid limits the way nutrients are absorbed, particularly calcium and other minerals essential for bone growth like zinc and copper. Studies have documented other deficiencies as well associated with the use of HCl suppressors, and these drugs may adversely affect bone remolding or bone metabolism. It is important to remember throughout our lives that bones need to be completely replaced cell by cell every 7 to 10 years. The point is that your body doesn't have a deficiency in acid suppressing drugs, but the symptoms your body is experiencing may indicate there is a deficiency somewhere. We at Capture Your Health are here to help you find a solution to your particular digestive needs. For cool relief and immediate support, click on the product icon on this page. If you are not quite sure about your digestive needs, fill out the digestive test located on this page. See what we can do for you. Thank you for checking out this edition of the Healthy Corner. This is Bud Tarreto for Capture Your Health. Have a terrific day.